Doctor, does thyroid hormone affect infertility and pregnancy?
Thyroid disturbances are very common in women than in men, and it constitutes between 3 to 10% out of every 100 women. In the area of reproductive medicine, the common hormone we check are the thyroid hormone, the prolactin hormone, and in the area of ovarian reserves, we check the AMH hormone. Here I'll be talking about the role of thyroid hormone, and when the thyroid hormone is excessive, we call it hyperthyroidism, and if it is deficient, we call it hypothyroidism. Hypothyroidism is relatively more common than hyperthyroidism, and deficiency of thyroid or hypothyroidism affects the menstrual cycle, which in turn affects the release of the egg or ovulation, and which in turn delays the conception. That means a woman who has a deficiency of thyroid hormone will have ovulatory problems which can delay conception. The other impact of an undiagnosed thyroid hormone deficiency is it also produces a higher incidence of pregnancy loss or abortions, and subtle thyroid disturbances can affect the neurological development of the baby. So in the last decade, there has been a lot of importance in testing the TSH or thyroid-stimulating hormone, which is increased in hypothyroidism, and emphasis on correction is there. A thyroid hormone or TSH accuracy will depend on the type of diagnostic techniques used. Essentially, there are 3 generations of technology, and the third generation, which has an accuracy of 0.1 milliunits per liter, is done at KrishnaIVF using a technology called Vidas technology. Once you have a diagnosis of thyroid dysfunction, then either your reproductive medicine person or your gynecologist or a physician or endocrinologist will ask you to take a tablet called thyroxine, and the dose is determined by your weight and the amount of thyroid deficiency that is there. The most important thing that is sometimes forgotten is when you're taking this thyroid tablet, you should take it in the morning and avoid taking the thyroid tablet along with iron or calcium tablets, as it affects the absorption. Once you have started taking the thyroid tablets, when should you do the test? The recommended estimation of repeating the test to adjust the dosage is 6 to 8 weeks from the time you have started the thyroid tablet, at which time you check the TSH hormone and the free T4 levels, and based on that you can adjust the dosage. If the report shows a normal value, a lot of times mistake it saying that the thyroid problem is eliminated. The answer is no. Only thing is they have been adequately replaced by the deficiency they have, and they should continuously use it and see their physician once in 6 months to 9 months for evaluation. In a pregnant woman, if they are already having a thyroid disturbance, a dosage adjustment is needed, and the thyroid estimation is done every 3 months throughout the pregnancy, since a disturbance of this can impact the development of the baby. So even though the thyroid looks very common, it's a very sensitive hormone, a very important hormone, and they should not miss it if they have been prescribed, and then they should stop it only with the advice and verification of the thyroid before they stop the thyroid. The other extreme is when the thyroid hormone is excessive, it is called hyperthyroidism. It affects fertility, it affects pregnancy. It can be diagnosed easily by TSH estimation, and it can be corrected easily. Unlike hypothyroidism, Hyperthyroidism impact on fertility is significantly less compared to hypothyroidism, but it does affect.